there we go. All right. Hi, everybody. And everybody out there is saying, hi, Dr. Nick, back. Just introduce myself really quick. I'm Dr. Nikita Vizniak, and I am the Chair of Physical Medicine at the Boucher Institute. And we are doing this Facebook Live chat for anybody who's interested and has any questions about the program. And just to give you a quick rundown of it. So my current title, as I've already said, I'm the Chair of Physical Medicine. I'm also responsible for teaching anatomy, physical medicine, which includes orthopedics, advanced assessment and treatment options, all the way up to manipulation, joint mobilizations and adjustments. And I have been with the school since 2003, so I've been here for a fair number of years, and I've seen a lot of students go through, so it's easy for me to see what skill set students should have and need to develop as they come through as a prospective student. So the most enjoyable part of teaching for me, I'm just going down a list of questions that we had ahead of time, but the most enjoyable part of teaching for me is actually my interactions with the students. What I like the most about it, because our class sizes are so small, you get really good one-on-one attention, and it also means you can ask questions. What happens in bigger programs, and we've had students transfer here from other programs, is that you get lost as a number, you don't feel comfortable asking a question. Here it's small enough, you get one-on-one attention, you get good support from other students ahead of you as well, and that's my favorite thing, is just watching students have those aha moments, realizations. A big part of my teaching style is in fact very didactic, so we're not actually sitting in desks the entire time. My biggest thing is to get you guys up and moving as much as possible. So anytime we learn about something as part of my teaching style, like let's say it's anatomy 1, we're learning about the upper extremity. So we show the upper extremity and we say, all right, so what muscles exist in here? What fascial layers exist in here? How do the nerves run? You draw it on yourself. Rather than doing simple multiple choice questions, let's be honest, most of us have been there for undergrad. What are you doing? It's binge and purge learning. All you're doing is learning information to repeat it, throw it up back on the test, and then you forget it. What are we about here? It says this in all of my syllabuses when you look at them. Question, will this be on the exam? Yes, it will, because we are about cumulative learning. So that means you build on skills, and information that you need gets hit again and again and again as you progress through the program, and it results in better outcomes. And you can see this on our board exam scores, our recent NMSA school performance. We basically blew all the other schools out of the water. And even the practical ability of our doctors when they get into practice, they have a high chance of success because they have such a good integration skill set that they've developed through the educational program here. So those are the key things that I have on those topics. Other things I would point out, students that are typically successful in the program, or particularly the courses that I'm involved with, usually you'll come in better if you have a kines background or something like that, but I've had students who have pure arts backgrounds and accelerate through. The biggest thing you have to be as a student is dedicated and present in class. For a lot of classes, and I know this from other programs because we kind of get the behind the scenes talk a little bit, there's classes that you can show up and miss the classes and kind of get the information later. Our classes are totally different. It is always worth your time to come and attend classes and to ask questions and get that one-on-one feedback. Because again, we're not just going from a book. If the information can be found on a book or on YouTube or something like that, that's where you're going to go. Spend your time there and work on it on your own time. But if you're coming to the classroom and have insightful knowledge that's being brought up as part of, okay, what's the basic anatomy, what's the clinical relevance, and then how do I do that skill? That's the biggest thing you're getting out of our classes that's different. And that's what I see for students who perform the best, is they'll come in and be dedicated. You don't give up sleep, you come in ready to play, and that's what I want the classes to be. One of my favorite points of feedback that I've gotten from a number of classes is it doesn't even feel like a class. It feels like you were playing the whole time and just having a lot of fun with the information, and before you knew it, you actually had clinical outcomes or learning outcomes that you could actually use in a practical way. So that's just huge for students to get. The other thing for students as well is you want to make sure that you get a good night's sleep before you come into class, and it's all part of being fresh. But even my job as an instructor, what do? I get you up, I get you moving around. So we typically don't even sit for more than 20 minutes. Then we get up and apply some information and move around a little bit. And of course, we always facilitate specific questions. It's your right to ask a question. With the small class sizes, it means it's easy for you to get information out. All right, what else can I tell you about here? Oh yes, the clubs that we have here. So you might notice this fantastic space here behind us. This is the Phys Med Room 7 that you're looking at, and a couple of neat things about this. We do lift and learns. Now most schools have lunch and learns, and this is where we got the name from. Lunch and learns are where pharmaceutical or nutraceutical companies will come in and tell you a little bit about their new product and why you might want to buy it, and the health benefits of it. What do? We do lift and learns. That is essentially station training as you move to different areas. So you can do body weight exercises, you can do some weight resistance. I know for some students out there who will be watching this, they are intimidated when they see the weights. You are going to have patients who are into CrossFit, Olympic lifting, whatever it is. This is another skill set that you actually break down that intimidation factor from, and get used to seeing, oh, you know what, the weight isn't that much, or you know what, I know the right way to do it. The other thing we do, and that's been great success over the last 2 years, has been a body weight resistance exercise type training that we do. I have never seen students with such big smiles or have such high intensity interval training done in such a short time. For students themselves, while you're going through the program, the convenience of this is that, we're sitting there in academia for a lot of the time. It's easy for you to maintain your exercise and fitness levels and also be in a convenient place. So right after classes, you show up, and it can be student-led exercise programs that are done, a great way to relieve stress and find that good balance in your overall lifestyle as far as being a student, your life outside of school, and then any exercise that you want to get. It's a great way to do it. And I know a lot of students who initially came into the program, didn't exercise regularly. One of my favorite things that students are doing is they are taking pictures pre and post. So they'll take a picture before they started working out. After 3 or 4 months, they'll take a picture again and show you the changes that they have. It's amazing. And this is a skill that you can take with you into practice. So if you have these pictures, you can post them up on your website and say, look, this is what I did. This is how I changed my exercise level, my routines throughout the day, and what I ate. And it relates directly back to the information that you are using clinically in practice. And especially if you can show you've done it yourself, then a patient can relate way better to you and is more likely to follow your recommendations. And it's just another way for you to attract patients and be more successful in practice. So that's that one right there. I pretty much discussed the delivery of my content. Why is the approach effective? The approach is effective because it's fun. If learning isn't fun, you have to wonder, what am I doing here? Why am I spending my time in this space? If it's fun, if you are engaged, if a class doesn't even feel like a class, that's exactly what you want. And that's my goal for teaching, is to not even make it feel like it was work. Typically, my class style is I actually give a quiz every week. Quizzes are there for you to stay on top of the information. But beyond that, if you do these regular quizzes, and the quizzes always go back to previous information as well, the key clinical stuff you have to know, and then we build on it. When it comes time for the midterms, the finals, the practical demonstration of skill, it is so much easier for you. And you talk to a student, they will tell you that, yeah, it was a little bit more work through the program, but by the time the finals came, it was the easiest final that I had, versus most programs when people are coming into their final exams, everybody's stressed out during the week. I'm not sure what I'm doing here. How can I spend time with that? I want my classes to be, when it comes to finals, the easiest classes, because you are so well prepared. Not because the information is easy, even though it'll feel like that because that's how I went through it, but because you are so well prepared for it, you feel like you've got it, you don't have to study. This carries forward to board exams. One of my favorite points of feedback was from one of our students who had to review for her 4th year board exam, so actually get licensure as a doctor. And her comment was, thank you so much for teaching the program the way that you teach it. I barely had to review at all for the largest part of my review for board exams, which is the physical medicine portion. And she said it was just fantastic. She knew it cold. She had to spend no time on it. She flipped through it to remind herself of anything, but there was no new information. There was nothing she didn't feel confident performing for her board exams, and ultimately taking that skill into practice with real patients. So that was excellent to hear that from Joanne Murphy. If you're out there, thank you very much. I should be saying Dr. Joanne Murphy. Excellent. All right. What else do we have here? Why is physical medicine an important modality for naturopathic doctors is another question. Physical medicine is foundational for naturopathic doctors. If you look at most practitioners now, medical doctors and a lot of physios and other practitioners, what are they doing? They're forgetting the benefit of therapeutic contact on patients. They're not making that initial contact with the patient, assessing range of motion. If we look at a balance of lifestyle, what is lifestyle? Lifestyle is mental, emotional, and physical health. Physical health is one of the foundations of what we're teaching at this institution, and physical medicine fits exactly into that. Yeah, the other reason for naturopathic doctors to pick it up is that you have the same scope of practice. If you're in British Columbia, and this is another question that came up, so I'll tie it in this way. If you're in British Columbia, you have the largest scope of practice of naturopathic doctors. That includes things like botanical medicine. That includes things like orthopedic assessment and treatment. That includes things like muscle testing. But beyond that, what a lot of doctors don't realize, and a lot of patients don't realize, you are also trained in all of the adjusting skill set as well. So that means like a chiropractor or physical therapist can do. You can do all the same adjustments, but you can also tailor it better and add in your botanicals, add in your nutraceuticals, add in your lifestyle, counseling changes. All that's available because you have this 1 hour visit, or whatever your treatment time winds up being. But typically for naturopathic doctors, you are seeing a longer term visit to get a better understanding of the patient in particular. Yeah, and I mean, that's the biggest thing. If you look at most medical practitioners right now, what's a visit time? 5 minutes, 10 minutes? I used to teach for the UBC medical program for medical doctors getting licensure there, and we had one of the medical doctors come in, and he was bragging how he saw 10,000 patients in a year. thinking to myself, yeah, that's great. Maybe you helped a lot of people, but what does that mean? That's 5 minutes per patient. How can you get a detailed assessment and really understand this person? One of the fathers of medicine, Hippocrates, he made a statement that it's more important to know the patient who has the disease than the disease itself. And you have to take in all those factors when you're evaluating a patient. So as part of our overall integrative treatment with the naturopathic principles, what are we doing? We're giving a long patient visit in physical medicine that gets you back to a therapeutic order from least invasive to most invasive. And this is huge for practice. You can't do that if I only have 5 minutes with you. I need to really understand and get engaged as far as your social support, your lifestyle, your diet. All of these things make a big difference. What's your job like? What's your work like? All that has to play a factor into it, not just, oh, you've got some subacromial bursitis, here's a cortisone injection, see you later, which, by the way, if that's still a treatment you're getting, the research is out and inexplicit against it. We know that this causes degeneration of the area, so you actually want to avoid that at all costs if you can, but that's a topic for a later day. All right, yeah, so we talked about the scope of practice for naturopathic doctors in BC. The only other thing I'm going to add to it is I have a question here, advice to any prospective students. My advice for prospective students would be, well, there's a couple of things. The first thing would be make sure that you're choosing this profession for the right reasons. You want to make sure that you've actually gone to other schools, see what they have to offer. My biggest thing for future doctors is have an open viewpoint, and then you'll see right away why we're better. The small class sizes, the integrated curriculum. We do things like Naturopathic Doctors International. Our students go down, and they are typically about a year to a year and a half ahead of other students. When we just did our cadaver dissection at another institution, and I asked one of their students, I'm like, okay, how are you doing for your orthopedic testing and your basic assessments, which we start in Anatomy 1 of all places, the very first semester you're here. They're like, well, that's not until 4th year that we learn that stuff. So they don't get this key, basic, fundamental physical medicine information until the very end of their program. For us, it's a continuing theme that we start with. So when you're looking at this space and looking at other curriculums, you have to realize that that's a core modality for naturopathic medicine, and it's a core modality for how we teach and have you guys integrate into practice. I don't know if I'm okay to talk about some numbers. Is that all right?
Numbers.
Numbers of income for some of our students they've got. I won't mention names, but...
Well, if they're interested in some survey with the...
Yeah, I mean, at the end of the day, for prospective students, you've got to realize you are going to be running a business at the end of this, but you also have to realize that there is good income potential in that business. So one of our all-star students, and I won't mention her name, but she does come in here and TA and teach a little bit. She's her 3rd year out, on her 2nd year out into practice, and she practices a fairly physical medicine heavy practice style. She billed in excess of $350,000. That means a net take home of around $120,000. And in the next year, she's actually, this last year, she's looking at billing in excess of $400,000 with a take home of probably $150,000 or something like that. So there is excellent income potential if you know how to practice and establish yourself correctly. And the fundamental skills that we give you right from the very start are there. Like I was talking about before, if you're learning about the arm or if you're learning about the shoulder, we go right into assessment. If you're learning about the eye, we go right into assessment. Now, it's a brief introduction. That skill set gets refined as you progress through the program, but is fundamentally different than most medical programs teach. When you're at other programs, what do? It's a PhD instructor who's going to give you good key basic science information, but the clinical information overlap isn't there, okay? There might be a little bit about pathology, but they're not going to get up and show you, okay, here's how you do an eye exam. Here's what this pathology means. Or here's how you do a cervical spine exam, taking you through range of motion. And, oh, yeah, what patients have you seen with this that you can relate back to saying, this worked out well and this didn't work out well. So that's what I have for you guys for right now. I don't know if there's any other questions, but that's about it right there. I don't know, Julie, is there anything else you want me to talk about?
No, I think that's it for now. So hopefully we can make it a regular practice and we can have you live here every now and then.
Absolutely.
So if there are any questions, so the post will be available online for anyone who missed Dr. Nick live. You can always go back to our Facebook page and watch the full video. If you have any questions, please send us messages. I'll be happy to pass it along to Dr. Nick.
All right.
And see you later, guys.
There's one other thing. I just want to say this just as a quick ending thing because a lot of people don't even realize this, okay? So you look at the back here, there's these little pull-up pulleys that we use right here. A lot of students come in and they, I don't know, for whatever reason, we have like 90% female population, and a lot of them don't think that they can do a pull-up. So what I do is I challenge students just a little bit out of your comfort zone so you can get used to moving around. And by the end of the first semester, usually, or 2nd semester, about half the class is able to do a pull-up. And it might not sound like a big deal and how this actually relates. We talk about shoulder biomechanics and how you move through it, all right? How you move through it as you're pulling down. but it's another one of those empowering steps that we give you as part of the program. It's not in the syllabus. You're not going to get a grade, as much as I wish we could, on how many pull-ups you can do or anything like this, but you are going to feel empowered by just doing these little steps every day that allow you to grow as a person and grow into the doctor that you want to be. So that's where I'll leave it right there, and I'll thank you very much for your time.